Good evening, viewers. My name is Raj Singh, and I'm a specialist dermatologist in private practice. I'm sure most of you all know what a dermatologist is. A dermatologist is a doctor who specializes in skin diseases. It's a very long journey to become a dermatologist. If you wish to become a dermatologist in South Africa, it will take anything up between 14 to 16, maybe 18 years before you qualify as a dermatologist. So we deal with, apart from the skin, we deal anything with the hair, anything with the nails, and we do a lot of aesthetic treatment, and we also practice with dermatological surgery. So it is extremely vast field because the skin is the largest organ of the body. This evening, I'm going to talk to you on one of the most common diseases in dermatology, which is known as psoriasis. And today, I'm also going to introduce you to a very interesting patient of mine. His name is Mr. Karou Charou. That's his alias name. He will introduce himself later on. And he suffers from psoriasis. And I think we should be very, very thankful that a man of his stature is going to share his disease with us. And hopefully everybody will benefit from the knowledge that we're going to derive from this wonderful patient of ours, Mr. Karou Charou.
Well, Doc, I mentioned this many times on my platform, a number of years recently. In the recent years, I suffer with a condition called, which you would know clearly, is psoriasis. In fact, I have psoriatic arthritis as well, but the psoriasis is, I've had it for many years. Slight scabs here and there come and go and that sort of thing. But I think over the past couple of years, it's gone progressively worse. And just on certain parts of my body where it is at. So now I'm trying to actively treat my condition, so to speak. So I'm looking for ways to treat it. And in speaking about it on my platform, I've come to realize how many hundreds and thousands of people are in the same situation as me. So I want to use my condition, how I'm trying to find treatment. As you know, you probably know, I've been through numerous treatments, from rubbing banana peels to whatever on my leg. You know, everyone's got a cure. I'm well aware that psoriasis is not curable. It's how I'm going to manage my treatment. I've learned that over the years, how to best manage it. So I'm not here for miracles. I'm here to be able to understand how can I better manage my condition, how can I get in a better position, possibly stop it from going the rest of my body. In that sense, I'm not sure. But yeah, I'm at a stage where I need to, I'm only 36. By the time I get to my 40s and 50s, I don't want to get worse and worse, you know. So yeah, I'm here to seek help, and I've heard some good reviews about you. Dermatologists are all over the place, and then done a bit of research in terms of patients who come to you and people who know you. So I believe I'm in the right place.
Thank you for flattering me. I'll try to do my best. And I always believe you do your best and you get the best results. But first of all, I must congratulate you on one thing, that you know what disease you have. At least I don't have to educate you as to what disease you have. Second thing is, you've made a very important point, that psoriasis is controllable but not curable. That's very important, because I'll tell you why. You are a typical patient who has tried everything, as you mentioned, from banana peels. I shudder to think what other things you've treated. But we must educate you regarding the disease, so that you'll understand what methods that we have, so that we can give you the best outcome. But at the same time, as with technology, there's some fantastic new treatments whereby we can actually help you and give you such good control that you can actually wear the shortest of swimming costumes in the beach, and nobody will even know you've got psoriasis. So there's hope. There's actually hope for you. And I will explain every treatment in detail, and you can make the correct choice regarding the decision of the various treatment options that we have.
Wow. Then my decision to come here is justified. It's what I want to hear. We're not promising the world. We need to be realistic in where we can go. Hearing about new treatments is actually fantastic. And that's what I believe is, when you go to someone, different people know what they're doing. We must be at the forefront of technology in the world, or the medical field, what's happening. And I'm glad to hear that, and I think I made the right choice. Thanks.
Mr. Casey, first let me examine you. Let me see the extent of your problem, then I can discuss all the treatment options.
Perfect.
Come inside, please have a seat. First of all, we have to examine you. Psoriasis affects 6 areas. The 6 areas it affects is the elbows, and I can notice your elbows are slightly affected. And also I notice both your elbows are affected. The second area that psoriasis affects are the knees. Yes. The third area it affects is the fingers, especially the fingernails.
I don't have much on the fingernails.
You understand you don't have much of the fingernails, but there is some psoriatic changes for the fingernails. The fourth area, I need you to remove your cap if possible. It will be the hair. Do your hair also affected?
Yeah.
Then the other area is the navel.
Navel is clear.
And then you also have in between the buttocks.
Yeah, I got it.
More area. So those are the areas. There's no doubt you do have psoriasis regardless. But otherwise, the psoriasis is what we use body surface area, or we call it the psoriatic area. And it is quite good because it's about 10%.
What is 10%?
10% is very good because that's what we try to achieve in some patient. And that's initially. But we're going to try and do our best so that you can wear the shortest swimming costume during the beach. What we're going to explain to you is that you've got psoriasis vulgaris. And we use a stepwise approach. So we classify it as mild, moderate, severe, and very severe. So what we're going to do initially, we're going to treat you with your normal topicals. As soon as I have your blood test, then I will email you the script on methotrexate. Now methotrexate is a very unique drug. You don't take it every day. You take it every week. Based on your body weight, we most probably will start off with a rather relatively low dose. Casey, I'm going to thank you very much for coming. I'm going to have your script ready. Unfortunately, legislation does not allow me to give you your script unless I see your blood test. And if I'm happy for your blood test, then I will email you the script.
Well, Doc, I must say thank you so much for seeing me on such short notice, for the consult. Extremely informative. Some of it I knew already, but also I learned a lot today. So I think I'm in the right place, and I want to start a dedicated treatment that I'm going to be following religiously, so to speak, not doing it half-heartedly. Because like I said, at 36 now, I'm getting on with the years. I'm going to get to be Kim K. That sort of thing. So thank you so much. I'm looking forward. I got to get my bloods to you, and then we take it from there. And it's been a pleasure. Thank you so much for it. Cheers. Walk me out.
Casey, I really thank you for coming into